Hi, my name's Jackie Barber. I'm Dr. Thurmond's nurse practitioner, and you're watching this video because you've been recommended by Dr. Thurmond to have a procedure called an anterior lumbar interbody fusion, also known as an ALIF. The intention of this video is to briefly discuss what to expect in the preoperative phase, the intraop phase, and the postoperative phase. It's also intended to answer many of the questions that you may have regarding your surgery. During the last office visit, Dr. Thurmond and I discussed the risks regarding your surgery. If you have any additional questions regarding these risks, please refer to the advanced consent form located in your blue folder. If you still have questions, please contact our office to make an additional office visit with me. I'd be happy to go over the risk again and to answer any additional questions that you have regarding the surgery. Before your surgery date, there are a few things that need to be completed. At the last office visit, Dr. Thurmond and I ordered preoperative tests. These tests need to be completed before the date of surgery. If you see any sort of specialist, such as a cardiologist, we will need to receive clearance from that doctor. Dr. Thurmond and I may also recommend that you receive clearance from your primary care physician. An anesthesia doctor will review your chart before your surgery. You will also receive a phone call from the anesthesia department to review your medications and to go over your past medical history. On the day of your surgery, you will arrive in the preoperative area. A nurse will work with you who will have you change into a gown, review your current medication list, your past medical history, and also start an IV. An anesthesia doctor will also come and speak to you in the preoperative area. They will answer any questions that you have regarding the anesthesia, and they will also ask you to sign an anesthesia consent. Dr. Thurmond will also come into the preoperative area. This will give you and your family members an opportunity to ask him any last-minute questions that you have regarding the surgery. He will also mark the area on your skin where he will be operating. There is a form in your blue folder entitled the preoperative checklist. On the day of surgery, Dr. Thurmond expects you to hand him that signed form. By signing that form, it indicates that you have reviewed all preoperative materials, including risk, benefits, and discharge instructions. Once it is time for your surgery, you'll be wheeled into the operating room via stretcher. Once in the operating room staff will help transfer you from the stretcher onto the operating room table. Anesthesia will then hook you up to monitors, have you breathe oxygen through a mask, and then they will utilize IV medications to get you off to sleep. A breathing tube will then be inserted. A nurse will insert a Foley catheter into your bladder. You will then be positioned supine, meaning face up, for the procedure. Dr. Thurmond will utilize a marking pen and x-ray to determine proper placement of incision. A general surgeon will make incision and gain exposure to the front of your spine for Dr. Thurmond. An x-ray will again be taken to confirm we're over the operative disc or disc. The disc or disc will be removed and will be replaced with a cage spacer that looks very similar to this model here. It will be packed with cadaveric bone putty. If you have any questions regarding the cadaveric bone putty, please refer to the advanced consent form located in your blue folder. Dr. Thurmond will then utilize screws to stabilize the implant to the spine. We will then use resorbable sutures for closure, and I will place stereo strips along the incision that look very similar to this. Anesthesia will wake you and take you to the recovery room. Dr. Thurmond will speak to your family. You'll be in the recovery room for 45 minutes to an hour and then transferred to the floor. You'll be out of a bed to a chair and walking with assistance shortly following your procedure. You'll be given a PCA during your stay. This will allow you to deliver pain IV medication through the push of a button. Your diet will slowly be advanced, starting with liquids and advancing to solids. You will be measured for a back brace during your hospital stay. You'll have to wear this brace at all times except for sleeping, laying down, grooming, and when you're up for short periods of time, less than 5 to 10 minutes. The day after your surgery, the Foley catheter will be removed. We will also discontinue the use of the PCA. You'll be transitioned into oral pain and muscle relaxant medications. Physical therapy will evaluate you the day after surgery as well. You may be discharged home once meeting all criteria. You must be able to pee, eat, walk, and your pain must be controlled on the oral pain and muscle relaxant medications. If you had an anterior lumbar interbody fusion performed, you need to be able to pass gas before being discharged home. You do not need to have a bowel movement before being discharged. Next, I'm going to discuss the most common symptoms following your procedure. Most patients will experience back pain and numbness surrounding their incision site. You may also experience new onset or persisting symptoms. These should resolve over the next few days to weeks following your procedure. If you had a fusion performed through a lateral incision, also known as an ALIF, you may experience an abnormal sensation affecting the front of your thigh and difficulty lifting your leg located on the same side as your incision. This should also subside over the next few days to weeks following your procedure. Next, I'm going to discuss post-op care. You will be sent home on a narcotic and a muscle relaxant medication. You may also be sent home on an antibiotic. Please take the antibiotic as prescribed. In regards to the muscle relaxant and narcotic, they are both as-needed medications. You do not need to take them scheduled. We normally send patients home on Percocet for the narcotic and Soma for the muscle relaxant. In regards to your dressing, you may remove it 2 days following the procedure. Please do not remove the steri strips along the incision. Many of our patients have problems with constipation due to taking the narcotic pain medication. Please refer the discharge instructions that will give you detailed information on how to treat constipation. In regards to sex, you may resume whenever comfortable. In regards to travel, you may travel as long as you're abiding by the restrictions that Dr. Thurmond or I gave you. I will see you 7 to 10 days following your procedure for a wound check. Dr. Thurmond will see you 2 months following the procedure. If you had instrumentation placed, you may have an x-ray scheduled before your 2-month visit. Both of these visits are routine visits, and we may schedule an additional visit if necessary. If you have any additional questions, please contact our office, and I look forward to meeting you.